My name is Dr. Caitlin Hall. I'm a physical therapist with Aware Health, and I wanted to take some time to discuss with you sleep and why it's so important for when we are rehabbing pain, including both acute injuries and chronic injuries. So, sleep is considered our sixth vital sign. We spend about a third of our life sleeping, and it's just as important to our health as physical activity and good nutrition. Sleep functions in promoting optimal brain functioning, as a poor night of sleep is often linked to reduced attention and reduced ability to retain information and learn. Pain can obviously have a huge impact on how we sleep. If we're uncomfortable lying in a certain position due to pain or an injury, it might take us longer to fall asleep, or we may be up multiple times a night to change positions. However, research has actually discovered a stronger link between sleep on pain compared to pain on sleep. So pain can often be not only cause of sleep deficiency, but also a consequence. Poor sleep quality and sleep deficiency are shown to be a risk factor for chronic or persisting pain due to the multiple impacts sleep may have on our nervous system, which also regulates pain. So, how can you improve your sleep quality and make sure you get that recommended 7 to 9 hours of sleep? Here are a few tips. One is to develop a sleep schedule and stick with it, especially a regular waking time. If you have to get up for work at 6 a.m. and you aim to get 8 hours of sleep, I would suggest getting to bed by 9:30, giving yourself a half hour to wind down so that you're setting yourself up to get that 8 hours of sleep. If you need an hour to get ready or to wind down before bed, get in bed an hour early, around 9 p.m. Second is to regularly exercise and do physical activity, but not immediately before bed. Even just 30 minutes of moderate intensity of exercise a day can make a big difference in your sleep quality. Three is to avoid drinking too much alcohol. While 1 or 2 glasses of wine may only have a small impact on sleep, alcohol in excess can have an impact on our normal sleep cycle and ultimately impact sleep quality. Four is to stop drinking caffeine 8 hours before your bedtime. Caffeine actually blocks a signal in our brain that promotes sleepiness and can take 2 to 12 hours to process and be removed from our body. If you typically go to bed at 10 p.m., stop drinking caffeine after 2 p.m. Five is to minimize naps. Short naps are fine, but if you're struggling to sleep at night, naps can exacerbate that problem. If you need a nap, aim for a 10 to 20-minute cat nap in the mid afternoon. Six is to limit electronic screen time before bed. Any type of light will stimulate your eyes and brain before bed and trigger your brain to think it's not time to sleep yet. So do your best to turn off your television, put down your phone before you're going to sleep. Seven is to create a relaxing environment. Sleep in darkness, reduce noise, keep temperature a bit cooler. Whatever you have to do to feel cozy and comfortable before bed, make sure that you do that. Eight is to use your bed for sleep only. Avoid eating, working at your laptop, or lounging in bed. Nine is to talk to Aware Health physical therapists regarding positions that may be more comfortable for sleeping. We can assess the problem, the pain point, what's going on, what positions may be uncomfortable for you, and come up with some strategies to help you sleep more comfortably at night.